Okay, so we're having it talking about the pharmacology of what? Ospemifene. Ospemifene. So this ospemifene is usually sold under the brand name Osphena. Ospemifene is usually sold under the brand name Osphena. You see, most of the medicine actually has what of Osphena on it. So we get to talk about mechanism of action of this drug, pharmacokinetics, clinical uses, side effects, administration, and all of that. For the overview, we see that this ospemifene is usually marketed under the brand name Osphena. It's usually marketed under the brand name Osphena. This is actually a SERM. It's a selective estrogen receptor modulator. So it's used primarily to treat moderate to severe what? Dyspareunia. That's basically painful sexual intercourse. Okay, and vaginal dryness, okay, which is associated with menopause. Okay, then what is the mechanism of action? It is an estrogen receptor modulator. So ospemifene selectively what binds what estrogen receptors, acting as an agonist or antagonist, and this is depending on the tissue. So if it binds to the what endometrium or vaginal epithelium, it has agonistic what effect, okay, which helps to improve the symptoms of vaginal atrophy. Then for tissue-specific effects, it stimulates the growth and repair of vaginal tissue, increasing vaginal lubrication and reducing what pain during intercourse. Okay. So for pharmacokinetics, this ospemifene is what well absorbed orally with a bioavailability of approximately 60%. Metabolism, it is extensively metabolized in the liver by the cytochrome P450 enzyme. Elimination, the drug is excreted primarily in feces, about 70%, and to a lesser extent in urine, about just 10%. The elimination half-life is approximately what? 25 hours. It has an elimination half-life of about 28 hours. Okay. Then for protein binding, this ospemifene is highly protein bound, about 99% of which actually affects the protein binding of other drugs. Okay, so for clinical use, just like we said, it's used in treating what dyspareunia and vaginal dryness, mostly due to menopause. The common side effects what vaginal drying, discharge, yeah, because you're trying to treat dryness, so you can actually what tip you into what the discharge. Okay, then serious side effects can include things like what thromboembolism, allergic reactions, fatigue, headaches, and endometrial changes. For administration, the standard dosage is about just 60 milligrams once daily, taken orally with food. Okay, so I think that's it for the pharmacology of what ospemifene, always sold under the brand name Osphena.